Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Shoulder injuries and disorders. Introduction. The shoulder is one of the biggest and most movable joints. There are many injuries and disorders that can affect the shoulder. Shoulder injuries and disorders can cause pain in the shoulder area and many other symptoms. Problems with the shoulder can also interfere with daily living by affecting how the joint moves. This program explains different shoulder injuries and disorders. It covers general symptoms and treatment options for common shoulder injuries and disorders. The shoulder. The shoulder joint joins the upper body to the arm. It is made up of 3 bones and many muscles, ligaments, and tendons. The 3 bones that make up the shoulder joint include the scapula, or shoulder blade, the humerus, or upper arm bone, the clavicle, a bone located between the rib cage and the scapula. The clavicle is also called the collarbone. The shoulder joint is covered by tissue called cartilage. The smooth surfaces of the cartilage allow for easy and painless movement in the shoulder joint. Ligaments are tissues that connect the bones together and help keep the shoulder in place. Tendons are tissues that connect muscles to bones. Shoulder muscles that are attached to the shoulder blade allow the shoulder to move in all directions. The combination of some of the muscles, tendons, and ligaments in the shoulder is called the rotator cuff. The bursa is a fluid-filled sac that is located between the shoulder joint and the rotator cuff. This prevents the rotator cuff from rubbing against the shoulder. Many shoulder injuries and disorders have similar symptoms. The main symptom is pain in the shoulder area. The pain may be severe. Other common symptoms of shoulder injuries and disorders include bruising, difficulty moving the affected shoulder, pain in the neck, back, or arm, swelling or weakness in the shoulder area. Some shoulder injuries and disorders may also cause a popping or tearing feeling, redness or tenderness at the joint, stiff and achy joints, visible deformity of the shoulder. Sprains and strains. A sprain is a stretched or torn ligament. Ligaments are tissues that connect bones at a joint. There are many ligaments in the shoulder that can be sprained. Falling, twisting, or getting hit can force a joint out of its normal position. This can stretch or tear the ligaments. Sprains can happen if people experience a sudden blow to a joint, twist the arm too hard, overuse the joint with repetitive motion. A strain is a stretched or torn muscle or tendon. A tendon is tissue that connects muscle to bone. A strain is caused by twisting or pulling a muscle or tendon. Strains can happen suddenly or they can happen over time. Treatment depends on the severity of the injury. It usually involves resting and icing the injured area, wearing a bandage or a device to compress the area. Medication. Treatment may later include exercise and physical therapy. Surgery may be needed if you have a torn ligament or ruptured muscle. Your healthcare provider will tell you when you can resume your normal activities. If you start too soon, you can injure the area again. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Torn rotator cuffs. A combination of certain muscles, tendons, and ligaments in the shoulder is called the rotator cuff. The rotator cuff is located under part of the shoulder blade. Causes of a rotator cuff tear may include heavy lifting, holding out an arm to break a fall, repetitive use or aging. Don't keep using your arm or shoulder if it is injured. This could lead to further damage. You can treat a torn rotator cuff by applying heat and cold and resting the injury. Steroid injections, physical therapy, and medicine to reduce swelling and pain can also help. Surgery may be needed if you have a large tear or if your symptoms do not improve. Fractures. A fracture happens when any one of the bones in the body breaks. Fractures of the shoulder usually affect the humerus or clavicle. Fractures can happen at the same time as sprains in the shoulder. A fall or blow to the shoulder can fracture the shoulder. Fractures are diagnosed with imaging tests, such as X-rays. Treatment for a fracture depends on the severity of the injury. If the bones are still in place, the shoulder and arm may be placed in a sling or other device. Surgery may be needed to treat more severe fractures. You may need physical therapy for a few weeks or longer to help regain strength and motion in the injured shoulder. Separations and dislocations. A shoulder separation happens when the clavicle and scapula separate. This can happen when ligaments that hold the joint together are torn. Shoulder separation is usually caused by a fall or blow to the shoulder. A shoulder separation is usually treated with rest and a sling to hold the shoulder in place. Physical therapy is often needed as well. The separation usually heals in a few months. Rarely, surgery may be needed to repair torn ligaments. Dislocations are joint injuries that force the ends of your bones out of position. A shoulder dislocation happens when any of the bones slip out of their normal position. Shoulder dislocations are common. They can happen when the shoulder is rotated too far or pulled outward. A dislocated joint is often swollen, painful, and looks out of place. You may not be able to move it. A dislocated joint is an emergency. If you think you may have one, seek medical care right away. Treatment for a shoulder dislocation might include a sling or shoulder immobilizer, bone repositioning, medicine, rehabilitation. Because of loose ligaments, some people may be more likely to have multiple shoulder dislocations. A surgery to tighten the ligaments and prevent further dislocations may be recommended in these cases. Bursitis and tendinitis. Bursitis and tendinitis are common conditions that cause swelling in joints and around muscles and bones. A bursa is a small sac filled with fluid. It provides a cushion between the bones and tendons around a joint. Bursae are found throughout the joints of the body, including the shoulder. Bursitis happens when a bursa becomes inflamed. Tendinitis happens when one of your tendons becomes inflamed. Most tendinitis is a result of the tendon wearing down slowly over time. Bursitis and tendinitis are usually caused by overuse, repeated injury to a certain area, or direct injury to a joint. People who do activities that require repetitive motions or that place stress on joints are at higher risk. Inflammation of a bursa or tendon may also be caused by arthritis, diabetes, infection, thyroid disease. Treatment focuses on healing the injured bursa or tendon. The goal of treatment is to reduce pain and swelling with rest, ice, and medication. Elevating the joint may be recommended. Wrapping the joint may help with tendinitis. Your healthcare provider may tell you to limit the amount of activity involving the affected joint. This can help your shoulder heal and prevent further injury. Severe cases of bursitis and tendinitis may be treated with other therapies, such as steroid injections, physical therapy, or surgery. Arthritis. Arthritis happens when the cartilage and the synovium in joints is inflamed or destroyed. There are many types of arthritis that can affect the shoulder. The most common is osteoarthritis. Osteoarthritis happens mostly in older people as a result of repetitive wear and tear on the joint. Treatment includes medication, splints, and physical therapy. Joint replacement may be an option.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The shoulder is one of the biggest and most movable joints. There are many injuries and disorders that can affect the shoulder, including sprains and strains, fractures, separations, and dislocations, bursitis, tendinitis, and arthritis, a torn rotator cuff. A sprain is a stretched or torn ligament. Ligaments are tissues that connect bones at a joint. There are many ligaments in the shoulder that may be sprained. A strain is a stretched or torn muscle or tendon. A tendon is a tissue that connects muscle to bone. A fracture happens when one of the bones in the body breaks. A shoulder separation happens when the clavicle and scapula separate. A shoulder dislocation happens when any of the bones slip out of their normal position. Bursitis, tendinitis, and arthritis are common conditions that cause swelling in joints and around muscles and bones. Shoulder injuries and disorders can interfere with daily living by affecting how the joint moves. Many shoulder injuries and disorders have similar symptoms. The main symptom is pain in the shoulder area. The pain may be severe. Other common symptoms of shoulder injuries and disorders include bruising, difficulty moving the affected shoulder, pain in the neck, back, or arm, swelling or weakness in the shoulder area. Treatment for shoulder injuries and disorders depends on the cause. Treatment may include rest, medicines, physical therapy, and surgery. Thank you for using Explain.